Digital Visa untuk kalian yang lapar akan hiburan. Digital Visa untuk kalian yang penasaran dengan pengetahuan. Digital Visa untuk kalian yang pengen bergaya, beli apa aja. Digital Visa untuk kalian yang pengen happy, di rumah aja bisa tetap party. Digital Visa untuk kalian yang anti nge-lag, jadi tetap connect. Bahkan Digital Visa untuk kalian yang anti ribet dan pingin cepat. Karena Digital Visa untuk Indonesia lebih baik. Digital Visa untuk kalian yang lapar akan hiburan. Digital Visa untuk kalian yang penasaran dengan pengetahuan. Digital Visa untuk kalian yang pengen bergaya, beli apa aja. Digital Visa untuk kalian yang pengen happy, di rumah aja bisa tetap party. Digital Visa untuk kalian yang anti nge-lag, jadi tetap connect. Bahkan Digital Visa untuk kalian yang anti ribet dan pingin cepat. Karena Digital Visa untuk Indonesia lebih baik.
Efficiency, cost, productivity. Business as usual has always been about turning a profit. If you stop to think about it, what more is there? The universe, nature, life, civilization as we know it is about the search for something greater than ourselves. Huawei Cloud is innovating technologies to make the world more inclusive. The cloud, AI, 5G are building a fully connected, intelligent world. They do more than drive digital transformation. It's a new paradigm for innovation. Imagine, if you can, what amazing secrets await when we unlock the secrets of the universe. What cosmic answers will we learn? AI can help preserve in the rainforest by identifying the sounds of gunshots or the sounds of illegal logging, protecting the most precious sounds, birds and trees for generations to come. In cities around the world, we can collect traffic data and analyze it to improve transportation and bring order to a chaotic world. Even reporting the weather can be improved with AI. With more accurate forecasts and timely alerts, we'll travel safer and get home to our loved ones. Also, so many delicious flavors, chili, herbs, and spices automatically selected to improve flavor, quality, and nutrition. Delightful flavor explosions to dazzle our taste buds. A cloud for everyone, unleashing the power of innovation, making every day better. A cloud for pervasive intelligence and a better future. Huawei Cloud. Grow with intelligence. Efficiency, cost, productivity. Business as usual has always been about turning a profit. If you stop to think about it, what more is there? The universe, nature, life. Civilization as we know it is about the search for something greater than ourselves. Huawei Cloud is innovating technologies to make the world more inclusive. The cloud, AI, 5G are building a fully connected, intelligent world. They do more than drive digital transformation. It's a new paradigm for innovation. Imagine, if you can, what amazing secrets await when we unlock the secrets of the universe. What cosmic answers will we learn? AI can help preserve in the rainforest by identifying the sounds of gunshots or the sounds of illegal logging, protecting the most precious sounds, birds and trees, for generations to come. In cities around the world, we can collect traffic data and analyze it to improve transportation and bring order to a chaotic world. Even reporting the weather can be improved with AI. With more accurate forecasts and timely alerts, we'll travel safer and get home to our loved ones. Also, so many delicious flavors, chili, herbs, and spices automatically selected to improve flavor, quality, and nutrition. Delightful flavor explosions to dazzle our taste buds. A cloud for everyone, unleashing the power of innovation, making every day better. A cloud for pervasive intelligence and a better future. Huawei Cloud. Grow with intelligence.
A wondrous civilization. Disposed to tranquility. With scenic landscapes bordered by the sea. Here, mythologies become principle. And religions create the cornerstones of life. It is contained in the arts and crafts, where celestial ceremonies become part of popular culture. Legacies of glorious traditions, where folktales are regarded as guidebooks to perfection, honed over centuries. yet possible to experience within a few hours. Experiences you can take home. Here, art preservation is a tourist attraction. History is a living monument. Even shopping is meaningful. See world-famous resorts compete with local means of accommodation. Enjoy natural kindness. Or the excitement of exploring nature. With endless stories to tell. And never-ending feasts. Never-ending possibilities. To get more out of life and journeys. Yogyakarta. Wonderful.
Ladies and gentlemen, welcome back to the afternoon session of the NINT ICoICT 2021. Before continuing to the next session, please allow me, on behalf of the committee, to extend a warm gratitude to our sponsors and, of course, our everlasting support. Thank you to Telkom University, Multimedia University Malaysia, Universitas Gadjah Mada Indonesia, the IEEE Indonesia section, IEEE Signal Processing Society Indonesia chapter, the Indonesia section, Computer Society chapter, Telkomsel, Telkom Indonesia, Telkom Sigma, Huawei, Yayasan Pendidikan Telkom, and also Microsoft for making this event a wonderful journey. And we also would like to remind all of the authors and also presenters that please go grab your chance for what? For the amazing award will be given by the NINT ICoICT 2021. That is the Best Paper Award of ICoICT 2021, which will be awarded on the third day of this event. So we would like to highly recommend every one of you to grab your chance, be the best of yourself, and of course, motivate yourself to become the best and grasp this award from the NINT ICoICT 2021. So ladies and gentlemen, let's start the next session. As we have already promised you all that we're going to have valuable knowledge from the prominent speakers. Therefore, let's step on the next agenda. The next keynote session will be presented live by a prominent speaker from Monash University, Professor Dr. David Tanier, on the topic of contact tracing during COVID-19 pandemic and Australian experience. And this session will be led by an inspiring moderator, Associate Professor Tis Dr. Ong Sian Song from Multimedia University. And please allow me to read his brief summary. Associate Professor Tis Dr. Ong Sian Song is Deputy Dean, Research and Industrial Collaboration in the Faculty of Information Science and Technology, Multimedia University, Malaysia. His research interests include data analytics and biometric security. He holds MSc degree in 2001 from University of Sunderland, United Kingdom, and his PhD degree in 2007 from Multimedia University, Malaysia. He published more than 60 international refereed journals and conference articles. He is a senior member of the IEEE and has also served as an editorial board for IEEE Biometric Council newsletter from year 2013-2015. So without further ado, let's welcome Dr. Ong Sian Song.
Okay, thank you, MC. So, good afternoon to everyone. Hi, I am Dr. Ong from Multimedia University. So today I will serve as your moderator for this keynote session of Dr. David Tanier. So before we start the session, let me introduce the background of Dr. David. So Dr. David holds a PhD degree from Victoria University, Australia. So his research interest is in computational theory and mathematics, distributed computing, information system, and mobile database. So Dr. David is also active researcher and has published many conference and journal papers, as well as co-author in the book related to database. And he is also the co-founding or the founding of editor-in-chief for a number of international journals. This include International Journal of Data Warehousing and Mining, Mobile Information System, International Journal of Web Information System, International Journal of Web and Grid Services. So he is currently an associate professor at Faculty of Information Technology, Monash University, Australia. So today, Dr. David would like to give his keynotes with the title of Contact Tracing During COVID-19 Pandemics and Australia Experience. So all the participants are actually welcome to type in your Q&A or your question in the Q&A box during the presentation. So without further ado, so let us welcome Associate Professor Dr. David Tanier for his keynote speech too. Okay, thank you.
Thank you, Dr. Ong, for the introduction. Thank you, the organizer, for having me. So I'm going to share my slide. Okay. I'm going to share with you a little bit of experience about contact tracing, especially in Australia. Now we know that every country is different, so the experience or the techniques or the methods that we use might not work in your country, in Indonesia or in Malaysia. But what I want to highlight is that regardless your situation, it is you can still see opportunities to do something about contact tracing in your country. So I'm going to share my experience in Australia, and hopefully it will give you maybe motivations, not necessarily in this area, but trying to solve this COVID-19 pandemic. So that is what I'm going to share with you, with all of you. So I'm going to explain a little bit, if you are not familiar with the Australian condition. So the COVID-19 pandemic, it is very different from Indonesia and Malaysia. And I know that at the moment, Indonesia is suffering from this pandemic very harshly. So my condolences to all people affected. So I'm going to start sharing this Australian. So I'm going to talk about a bit of background and then the transmissions, digital footprint, and then finally our contact tracing project. So let's start with the first one. So I'm going to go through the history because this is already 18 months and we are still learning actually how to deal with this, right? We thought that we get on top of it, and then suddenly there's a new outbreak, and then there's a new strain which is more infectious than the previous one. So even the medical people, healthcare people, are still learning day by day. So as we know that it started perhaps late 2019 December, and then in January, there was news from China that there is this new kind of pneumonia, right? Australia, because we have a lot of visitors, tourists from China, and we got it in about late January. So people arriving from China, and then we got it. So the first case in late January, and then the first death, and so on, right? So that was about January and early February. So what we understood at that time was that we need to close the borders. So it means that we need to close the border, means that we need to stop people from coming to Australia. So that's what we did in late January and early February, when we actually stopped all the flights from China, right? But at that time, we only limit the ban, the incoming passengers only from China because they started this flu type of virus. Then in March, around March, we had more infections. The reason was because the flights were still open from America and UK, and also from other parts of Europe. So they brought in, the virus, especially from those resorts. Quite a number of people got it from ski resorts in Europe. So the government then suddenly realized that we need to stop all the incoming flights. So that was the first lockdown, right? So in that case, the lockdown was limited only for 4 weeks, and passengers coming from overseas need to isolate, and then people introduce, then the government introduced social distancing. Then gathering was restricted. Traveling was only permitted 25 kilometers. So what we mean by 25 kilometers is that people from the metropolitan Melbourne cannot go outside Melbourne, right? So they cannot go to the regional Victoria. The fine, the penalty is very stiff, right? You can fine up to more than $10,000 if you break the rules. And then if the company, corporates break the rule, then they will be fined very almost $100,000. So at that time, we were still trying to understand what lockdown means. Yeah? So that was about, mid-March. And then everything was, closed. University moved to online. Everything was closed. Big companies started to encourage people to work from home. Companies closed. So that was the first lockdown in March, right? So this is a kind of,
sorry, Dr. David.
Yeah.
So my interruption. So we'd like to request you to increase the sound volume. So because we can't hear clearly from our side.
Okay.
Thank you, Dr. David.
Let me see. Sound. Okay. So this is the kind of photos that are quite common. So police were everywhere. They were checking the movement, so people cannot move very far away, right? And then very interestingly, that when the lockdown was announced, then people start getting panic, right? So I don't know in Indonesia or Malaysia, but in Australia, toilet papers. So a lot of people bought toilet papers, and then the shelves were empty. Although the government said that you can still go to the supermarket. They were still open. The distribution was still okay, but that changed the behavior of people. And in fact, there was this video at the top corner there, people fighting about toilet paper, right? So the borders then closed, right? So in about mid-March, then Australia borders were closed. So it means that we don't have any incoming passengers anymore, right? And then at that time, the government started this quarantine program in the hotel. So that started in about mid-March. So one thing that is good is about lockdown is that the government introduced a payment method that is JobKeeper. So it means that if you are affected by this lockdown because you are working in the for example, in the restaurant, or you're working in the hotel, and then you can't go to work because of lockdown, then the government pay you. So that is the JobKeeper, right? So I think got some payment, which is probably similar to their salary, so which is good to support them, and also small businesses, especially the restaurants, cafes that were closed during the lockdown. they also get some payment. Although the payment for the cafe and restaurants was not that much, I think about 1,500. But if they open, say for example, they can earn $10,000 per day. But nevertheless, they got a bit of payment. But most of the payment went to the workers. So in April, early May, then the government started to introduce a new app, mobile app, which is a COVID safe app. If you are near to the people who are infected, right, then you get notification immediately. So that was the idea, right? So initially the download was very slow because people were concerned about the privacy and so on. But I think people downloaded. But one thing that is strange about technology is that because it uses the handshake technology, and then as we know, Bluetooth handshake sometimes doesn't work because of different systems. After many months, I think many weeks, this app was launched. Not even a single contact was detected, right? So we realized, or the government realized, that this system did not work as promised, right? So and at the end, people abandoned using this, right? So this is also one lesson for us, that when we try to solve a problem using our technology, using our research, sometimes it works in the lab, but when you actually launch it in the real life, it doesn't actually work, right? So I think in this kind of scenario, we need to work closely. The technologies, the researcher must also work closely with public health, do a testing and so on, right? Rather than just proposing an app that might work in the lab situation, but actually it doesn't work at all. So that was quite embarrassing to the government. So the first lockdown ended in around mid-April. So as you can see the timeline at the bottom, the number of cases became very low. Sometimes we get zero. As you can see, the top of lockdown from mid-March to mid-April, we would probably get maybe, I don't know, maybe maximum 20 or 30 or even 40, right? But when we do a lockdown, everybody is isolated, then the number of infection turned to zero, turned to very minimum, right? Like 1 or 2. And then the lockdown was lifted, right? So that was in about early May, right? And then at that time, we started to do testing. So government said that although the number of infection is low, but it doesn't mean that it is low. Maybe we haven't caught it, right? We haven't caught the people who got it. So then the government do a lot of testing. Some people even go to the house, each house, and then to do the testing, right? So around mid-May, that was a good time for us until June. In the first lockdown from March to April, we increased the level from stage 1, stage 2, stage 3 with different requirements. So the last one was stage 3. It means that you can only travel if you go to school. School was still open. If you went to the supermarket, if you go to work, if your work is essential, right, such as in the medical area. So we were very happy. We thought that this pandemic would end very soon. So that was in May and until June, right? And then suddenly in early July, we had an increase of infection per day. So at that time, from maybe one or two per day, and then suddenly increased to, I think at that time, maybe 20 or 30, right? And then the government suddenly imposed a stricter lockdown. So that was early July, right? And then the number of infections increased up to, as you can see the graph at the bottom there, increased up to about 700 or 800 per day in total. And the lockdown was stricter. There was a curfew from July to September. Curfew means that you cannot go out from 8 o'clock at night until I think about 5 or 6 o'clock in the morning. So it's like a war situation. You cannot go out, right? During the day, you can only have 4 reasons to leave home. The first one is you can go to the supermarket, I think, and then go to clinic if you need to, go to work if you are a medical, and then one more is I think you can go exercise around your block, okay, for maximum 1 hour, and only one person per household. So that was very strict from July. So it means that people from Sydney cannot come, people from Perth cannot come, right? And people from Melbourne cannot go to another state. So it is contained, yeah. And if and the police patrol in the border, right? So if you try to cross, then basically you'll get a lot of fine, right? I think there was one story at that time. There was a family near the border between Victoria, because that was just a bridge that separate the both states. There's a river and then a bridge, and then this family just because the daughter said that, oh, let's go to the cafe. There's a nice cafe there over the bridge, right? And then they went over the bridge, okay, went to the cafe, and then the cafe maybe closed or something, and then they went back, and then got caught by the police, right? So they cannot come back. So that was very, very strict. So the border was closed, right? So that was very strict lockdown with the curfew. And then also the government introduced state of emergency. Now at that time, I didn't know what state of emergency was. So state emergency was, a state of emergency means that the government can introduce new law without going to the parliament. Right? So it is like in the war situation that the government can introduce something, a new policy or new law without going through the parliament. So at that time, the state of emergency was introduced. Then the government imposed more rules so that people must follow. So as I said, restriction was very tough. Only 5 kilometers, so you can go from your home only 5 kilometers, and then a curfew at night. So you cannot go out from 8 p.m. until 5 a.m. in the morning. You can only go to the supermarket. You can go outside for walking. School closed. So school means primary school, secondary school, and a lot of restrictions. So the good thing is that in about October, suddenly it went down, and then early November, the lockdown was lifted, right? And then we got 0 infections from the community, right? So we call it Donut Day, right? So if there is an announcement, right, that this is Donut Day. So Donut Day means that it is 0, right? zero infection. So we were very happy as a citizen in Melbourne at that time, because we followed this lockdown, and then that was very harsh, about 2-3 months, from July to about end of September, maybe mid October. So that was really really tough, and then we finally got it. So that was the happy time. November, December, a lot of donut days, no infections. But now in 2021, this year, in February, we had an increase, because we get used to the zero, and then suddenly when the increase, the number of infection becomes a few, then the government was starting to get a bit worried. So there was a lockdown in February, only about 5-6 days, and then suddenly it becomes zero again. And then in June, early June, last month, also we had another lockdown for 4 days, and then after that, lifted. And then the last lockdown was just 2 weeks ago. That was tough. As you know, in Sydney now, they are suffering from Delta variant, and then there was a driver, removal driver, did a removal. So they brought something, from Sydney to Melbourne, and then at the end they actually got it. So they brought the virus from Sydney to Melbourne, and then we had lockdown about less than 2 weeks, about 2 weeks, and then now it is okay. So that was just a short, run through of what happened. It is very different from other countries, from your place. So that's why we want to share this, and then see what kind of methods, because my intention of this keynote is not just to show my experience, but also encourage you to to have new ideas, and perhaps more collaborations in this area. Right? So that was the 3 lockdowns in 2021, and then now everywhere we have a QR code. So I think maybe about so we started about 6 months ago. We have QR code, and then if you go to any place, to restaurant, supermarket, to shopping mall, anywhere, you need to scan the QR code and then register. If you have already registered, then your name and phone number, the detail, were recorded automatically, right? So, but if you don't register, if there's a outbreak, and then an infected people visited that place, and then the government wanted to know who other people visited that place, if they knew that you didn't actually do a QR code, then you'll get fined, right? And it is so expensive, yeah, almost more than $1,500. So everybody was trying to do the QR code every time we visit a place. So this is the recovery plan from the government just last week. So at the moment, it is the current phase that we are trying to suppress the virus. We want to get as low as possible. And then we are going to transition, we are going to phase B if 70% of the population is vaccinated. Now, at the moment, the vaccination rate in Australia may be around the first jab, around maybe less than maybe 18-19%, right? And for second jab, sorry, for 2 jabs, about 19%, right? The first jab maybe about 41-42%, right? So now the government said that you must get 70%, and then we will reduce the restrictions. And then for phase C, if you get up to 80%, then we will reduce even more. So that was the news currently from the government. Right? So that was just a bit of background story about what has happened in Melbourne, especially. Now, why is COVID very infectious? Now, we all already know, we have learned this for 8 months, that it is airborne. Then if you touch the contaminated surface, and then you touch your nose and mouth, then you'll get infected, right? But the problem is that when you get infected, then the place where people visited may become exposed, right? Then that will create a full chain of infections, right? But what happens is this. So if you're a healthy person on the left-hand side, that's fine. And then on day D, okay, day 0 in this case, if you got infected, you may not feel the symptoms immediately, right? So there is an incubation time. So at that time, maybe you walk around and then you go somewhere else, and then but you are actually already got infection. But at that period of time, then you will infect other people, right? So that is the problem, right? The incubation time, right? Because once you get tested and then you are declared as positive, then by law you need to stay at home, right? Here what I know is that every day, this is the news just recently, if you are one of these people, then the Department of Health will call you any time of the day, and then they will say that I will pass your house in 5 minutes. You must stay near the window with your phone, and then I will call you, and then you need to state your name, and then you need to wave your hand just to make sure that you are the person, right? So that was really strict, right? So that's why contact tracing becomes important. So contact tracing means that while it is in incubation period, we need to know who should be contacted, okay? From the Department of Health, they need to know who should be contacted, right? And then they're really serious, right? So if in the day 0 or day 1, and then they interview you. So what happened is this. So this is day 0, and then at day, for example, when you get tested, day 7, okay, you are positive, and then they will ask you, okay, where have you been in the last 7 days, for example, right? And then they will interview and try to dig you out. And then if you say that you are that you visited a shopping mall, right? And then they will try to contact people who visited that period of that place at that time, right? And then the places were normally published in the newspaper, right? So sometimes we check and then see. We try to avoid certain places, right? So that's why contact tracing becomes important. Right? Now, the problem of contact tracing is that how do we get the data, right? Now, if you think about it, wherever you go, basically you leave your footprint. When you carry your mobile phone, right, they know where you are when you move around. When you go to supermarket, shopping mall, when you use your credit card, they know that you visited that place, right? So there are many technologies, cellular tracking, GPS, transaction history, as I said before, even CCTV surveillance, right? So it is your footprint basically everywhere, right? Now, of course, it is very difficult to get the complete data if we don't work in the government. Right? So what I'm going to show you is that the techniques that we develop that might be useful in the contact tracing context. Right? So the concept is that I'm going to discuss two methods. One is the outdoor. Right? So the outdoor means that if you drive from your home to a certain place, maybe to a shopping mall, and after that you drive to somewhere else, right? So we want to find out the common place that you visited, right? And then if we have all trajectories from all people, then if one person is infected, then we know who should be contacted for further notifications, right? So that is number one, which is the outdoor. The second one is the indoor. The indoor is slightly different. In this case, more sensing technology can be installed in the building, in the rooms, to actually detect who actually visited that place, right? And then if it is in the university context, maybe each student can have an RFID tag, and then they know if they are close together. Or if in the hospital, then doctors and nurses may have a certain name tag, and then we can detect that, right? So these are the two that I'm going to share with you. Now, as I said, that the situation here is different. It might be difficult to be used or implemented in your country, right? But I'm going to explain the indoor, especially a project by my former PhD students, which collaborated, which is now doing collaboration with University of Undip Diponegoro in terms of contact tracing, right? So collaboration is possible if we are open-minded and then try to think what kind of solutions as the technologies that we can provide, right? And then if we are trying to work with the healthcare workers, with Department of Health, with hospital, with doctors and nurses, we might get more ideas, and therefore, you know, our contribution will be more meaningful in this case, right? So let's start with this, the first one, which is the contact tracing in terms of outdoor, in the context of outdoor, right? So as I said, the concept of this outdoor contact tracing is that if we have trajectory data, so trajectory means that the movement of data, then we can have an algorithm, the method, to identify places, common places where people visit. And then if one person is infected, then the entire people who visited that place at the same time will also be contacted, and then will be isolated or get tested, right? So this is just a slide about contact tracing app that was launched in Australia, COVID Safe app. In Singapore, there is another app, I think in Malaysia. I don't know about Indonesia, but in Australia, it doesn't work, right? Because in the lab, when we test two mobile phones close together, in the lab situation, it works, but in the real life, it doesn't really work. So once the system doesn't work, then the people will not use it anymore. Right? So basically, it is all abandoned. So I don't know how many millions was invested in that. Right? So let me show you. Right. So we have trajectory data. This is a crowdsourced trajectory that we use. So this trajectory, as you can see, we plotted on a map. So in this example, this person, I don't know, moves from Balan on the left-hand side, and then move. Melbourne is, at the bottom on the right-hand side, and then move around, right? So this is an example of how a trajectory looks like, right? Now, if you think about it, if you have the trajectory data, then developing algorithm to find a common place will not be that difficult, right? But in real life, it doesn't work that way, because trajectory data, when you install a GPS tracker in your car, any sensors would produce some noise, some errors. Yeah. So I'll show you. Oh, sorry. Yeah. So I'll show you. This is one example. It is not quite. Say on the left-hand side, this is trajectory of car moving, right? And then this is the second one. As you can see, it doesn't quite follow the road. And also, as you can see on the left-hand side here, the car seems like moving up and down, right? Which doesn't make any sense. And then also here at the bottom, there's a tunnel, and then the signal, loss, and then we don't get the data. And then if you look at the roundabout here, a lot of noise, right? So accuracy is one of the main problems in trajectory data. So even if we clean it, right? What we want to do is that we want to find a place, like for example, this is a shopping center. So this was an outbreak in February, when there is a butcher shop, right? I think one of the workers got infected, and then basically the virus spread because people come in, buy something, and then they go home. Okay, they infect, the family members. Right? So what we want to do is that we want to find a place, a common place, based on the trajectory data. So in this case, we have several options. One is that we can use a minimum bounding box, like on the left-hand side here. This is a shopping center, shopping mall. Or we can use a grid like this in the middle. So if your trajectory visited one of the grids, so we are using grid base. Or the last one on the right-hand side, we can use mesh block. So mesh block is an area defined by the government. This is for urban planning, that this is one block. Yeah? So one mesh block is probably a few houses, right? Or one shopping mall, say for example this one, right? So in this case we use mesh block, right? So this is an example of mesh block in Melbourne. So the small rectangle, the small area is a mesh block, and then they will group into SA1 for statistical purposes. So I don't know in Indonesia and Malaysia, maybe you have similar kind of urban land partitioning. Right? So we use mesh block to process our trajectory. So what we did was that we proposed mesh block sequences. So from each trajectory, we convert into mesh block sequences, right? So it means that you are moving from this mesh block to another mesh block and to another mesh block, right? But if you are moving in high speed, then probably you are in the car. Then it is not considered that you are stopping there, right? When we started this idea, we found that there's a lot of improvement that can be done, right? Because here we are only talking about driving, right? What happens if you are walking, for example, or we haven't really considered public transport, or for example, you are taking Uber, and the driver or the passenger is infected, and then that will infect the driver, and the driver will infect other passengers, and so on. So we haven't really considered that. So a lot of issues that can be looked at from the trajectory data, right? So this is just one of them. So in this case, we convert, as I said, the trajectory to mass block sequences. So you are moving, say, for example, from here, and then touch this mass block, and then this mass block, and then I don't know, you are moving around here, and then so in this case, a few mass block were visited. Yeah? So this is one example of this trajectory. So the person, I think, moving from the left to the right, and then in this case we focus on this mass block, which is, I think, a big place. I think convention hall, and then another place here, and another place here, and another place. So this is an example of trajectory. And after that, we converted into mass block. So a few mass block that are impacted, right? So the red areas are the mass block that are impacted, right? And then we convert into this line, and then we use the tabular method, and then we find all trajectories that visited that mass block at the same time, right? So in that case, we can find the first level of people who visited the place at the same time, right? So a few pictures that I'm not going to show you all. So this is one example. This is a big convention hall. So if you're infected, for example, this trajectory infected, then as you can see, from 8 to 10 p.m. AM, then a few candidates, visited that place at the same time. So they should be contacted. All right, so that was our work on trajectory. As I said, a lot of issues that still need to be dealt with, and we're open for suggestions, collaborations. I think this is an important area, and we have expertise in trajectory processing, map processing, and that kind of thing. Then we can work together. What I'm going to show you, the second one, this is almost my last one, is the indoor environment. So in the indoor, we cannot use GPS, right? Because in the building, GPS basically it's not a good idea, right? So what we want is that we want to use low cost sensing technologies, right? And then to detect people, and then analyze their movement, and then the impact to contact tracing, right? So this is the one that I'm going to show you. This is a project by my former PhD students, Dr. Kiki Adinugraha from La Trobe. I think many of you knew him. He was from Telkom. So now at La Trobe University. So he got a grant, collaboration with Undip in Semarang, with two medical doctors. So this is collaboration between La Trobe and Faculty of Medicine in Undip, right? And this is funded by the Australian Academy of Science. Right? So what they want to do is that they want to see if hand hygiene practices are being followed, right? By
Sorry, Dr. David, allow me to interrupt. I think we need to open the question from Q&A now. So maybe you can have another 5 minutes for your presentation, and followed by Q&A. Thank you.
Thank you. So what they want to do is that they want to analyze if people follow the hand hygiene practice or not, right? And then if they know that sensors are implemented, are actually installed in the building, and then also analyze the movement data, and then they will want to know whether they change the behavior or not. So this is about behavioral changes, knowing that the technology is already there, right? So in this case, this is still ongoing. they're using, as I said, low cost sensing technology. They implemented, they wrote the app, and then a few other things. And then this is, I think, implemented in either in the campus or in the hospital. Right? So this is one of them. So it is still ongoing. So the aim is that they want to collect the data, the movement data, and then try to understand if this technology would help people change the behavior, and therefore we can restrict the movement. Right? So thank you for listening. So just a bit of experience that I would like to that I've already shared in terms of outdoor processing and as well as indoor processing. A lot of opportunities, I would say, a lot of problems, and problems are opportunities that we can, that we can solve as a researcher, because we need problems. So as you can see, collaborations not only from computer scientists, from medical, from maybe public health, because they will be able to give their perceptions and then see whether we can contribute to solve this interesting problem. Right. All right, so that's the end of my presentations. I hope this gives you some ideas and maybe motivations to solve this interesting problem, depending on your situation, of course, in your country. But I'm sure that they're different, but you may have new problems that you can solve in your context. Thank you.
Okay, thank you, Dr. David Tanians. So now I think it's a time for us to open the question to the member of the floor, to all participants. So participant, you have any question, maybe you can type in your question in the Q&A box. So we have 10 minutes for the Q&A session now. So any questions?
I think the challenges for Indonesia and probably Malaysia as well, I mean, they're different. But I think if you think hard, because the lockdown in Jakarta is different from here, and also isolation, isoman, very different. People still go around, and then here, if you are isoman, you cannot go out until you get negative at all, right?
Okay.
Whereas in Indonesia, you get negative for a few days and then you feel unwell. And after that, you feel well, then you just go out. So we don't know whether that was a good idea or not. Maybe you still get the virus and you may still infect people, but different situation. So what I think is that we need to think hard how to actually, use our research area and technology, perhaps, to contribute, whatever small that is, right? Because it is not possible for us to solve everything. We need to work with people, other people.
Okay, so thank you for your sharing. I think maybe I have one simple question to Dr. David. So the question is about privacy. So I believe Australia, they have a Privacy Act 1998. So any so-called policy currently to fighting the COVIDs? So is it in line with this Privacy Act 1998?
That's a very good questions. Privacy is always an issue.
Yes.
In whatever setting. In this case, we are not using the COVID data. We are using trajectory data, which is actually crowdsourced, right? So we are not saying that we use this data to actually track people and then notify the government to do that. We wouldn't be able to do that because even if we work in the government, that wouldn't be that easy. But as a scientist, what I feel is that we should contribute in the knowledge itself. So what we are doing at the moment is that in terms of outdoor, then we can provide methods or algorithms that may work in some situations. It will not solve the whole situation, but at least people can start thinking, building up from that. In terms of indoors as well, the project is still ongoing. That the aim is just very simple. If we have the data, the movement data from students, from nurses, from doctors in this particular hospital or campus, then hopefully we can tell whether the technology can be used to, low-cost technology can be used to change the behavior of people so that the virus will not spread that easily.
Okay, thank you for your sharing. I think now it's come to the end of today's session. Thanks again, Dr. David, for your fruitful session and a great sharing to all the participants of ICoICT 2021. So now I return back to the MC.
Where is the MC?
Yeah, MC.
Is he gone?
Here.
Yeah.
Okay.
Okay.
Thank you, Professor Tanya and Dr. Ong Tian Song, for this amazing session. It was very amazing, especially to get to know the current condition in Australia. I have also a friend of mine there, and it's really, I think, based on what I've observed from her daily life, it's quite different when she conducts isoman. So it's quite, yeah, that's the unique of the world. Well, anyway, thank you, Professor Tanya and Dr. Ong Tian Song, for this amazing session. And now we would like to kindly invite both of you to have a photo session. All right, so we would like to invite the committee for having this session. 1, 2, 3. But once again, I think it's a bit too formal. What about having a very sweet smile between both of you? Because I think it's a golden chance for both of you to have a photo session. Well, do you mind if we repeat once more?
Yes, okay.
All right. So do you want to imagine that you have your wife, beautiful wife, or maybe beautiful children in front of you? Then you give your sweetest smile. Oh my God, that's very beautiful. All right. So within 1 to 3, we would like to count it. 1, 2, and 3. Well, thank you so much, Professor Tanya and Dr. Ong Tian Song. It's going to be very beautiful when we broadcast it in our YouTube channel, Telkom University, of course. Ladies and gentlemen, let's move on to the next agenda. That is the keynote speech will be presented live by Director of Transformation and Digital at Biopharma Indonesia, Mr. Soleh Ayubi, PhD, on the topic of COVID-19 vaccine distribution, an example of accelerating healthcare transformation. So before starting the session, I would like to read our moderator's brief summary. Ms. Angelina Prima, PhD, is a senior lecturer at the Bachelor Study Program of Informatics, School of Computing, Telkom University. She pursued her doctorate degree from University of Leeds, United Kingdom, majoring in computer science, and her research area is on process mining, data science, and also information system. And currently, Ms. Prima is working on some projects. Those are IT integration master plan with Biopharma Holding Company, sentiment analysis of Indonesia healthcare insurance with Health Social Security Agency or BPJS, and also Universitas Gadjah Mada, and tuberculosis patient pathways under Indonesia National Health Insurance, Health Social Security Agency, and Universitas Gadjah Mada. So ladies and gentlemen, without further ado, let's welcome Ms. Angelina Prima, PhD. The floor is yours.
Thank you, Ms. Yayan, for the introduction. Good afternoon, everyone. welcome to the third keynote speech of ICoICT 2021. I am Angelina and I will be the moderator of this session. We are honored today to have Mr. Soleh Ayubi, PhD, as our speaker in this session. Please allow me to read the profile of Mr. Soleh Ayubi, PhD. Mr. Soleh Ayubi, PhD is the Chief Digital Healthcare Officer at Bio Farma Indonesia. He pursued his Doctor of Philosophy in Health and Rehabilitation Sciences, University of Pittsburgh in 2012. He has a lot of outstanding experiences, including the President Commissioner of PT Kimia Pharma Apotek, June 2021 until now, and then Boston Children's Hospital as Technical Innovation Manager in 2013 until 2016, and United Health Group as Director of Innovation, Research and Development in 2017 until 2019, at Novo Nordisk in the United States as the Head of Digital Therapeutics and Data Science 2019 until 2020, and also Digital Health and Entrepreneurship Mentor of Harvard University in Boston, United States since 2017 until now. He also has a couple of recent publications, which are using smartphone crowdsourcing to redefine normal and febrile temperatures in adults as a result from the fever print study, and also issues identified by post-discharge contact after pediatric hospitalization, a multi-site study. All right, today he will deliver a speech entitled COVID-19 Vaccine Distribution, an example of accelerating healthcare transformation. So ladies and gentlemen, without further ado, let's welcome Mr. Soleh Ayubi, PhD, to deliver his speech.
All right. Thank you so much, everyone. It's an honor for me to be here with distinguished professors, researchers across, it seems like Southeast Asia, right? And then also some people from Europe and some people from US as well. Thank you so much. Can I share my screen? A second. All right. Yeah, today I'm going to share with you more of kind of practical experience. You know, I've been working mostly on research and innovation, but today I'm sharing with you about my different perspective, which is more on practical perspective. But I do believe that, you know, some of the point that I will share with you could be an example of some kind of research as well as what's the scientific takeaways. So the first thing that I want to share with you is the context of this project, right? Or the context of this initiative. We know exactly that Indonesia has to distribute COVID-19 vaccine and other vaccines for about 600 million doses this year. And this one is going to be like the first experience. This one is going to be a breakthrough history for this country because previously, I think the highest number that we deliver, the highest number of vaccine that we distribute across the country is about 200 million doses. So what we're going to have this year is going to be like 3 times or almost 4 times of the highest capacity that we did before, right? This number represents something new, right? It's new initiative. It's new people to join this initiative. It's new situation, right? You know, as you might know today that we have some limitation on moving staff or you know, traveling, that kind of things. It affects how we distribute vaccine, of course, right? The second thing that I want to highlight here, just to give you context, is that vaccine distribution is very highly regulated area. It's not like transporting books or transporting, something else. When we talk about transporting COVID-19 vaccine, there are some requirements from the regulation. There are concept of cara distribusi obat yang baik, or we can call it like good distribution practice, GDP, right? There are some regulation from Indonesian FDA, as well as from the WHO, as well as from the manufacturer or the producer of the vaccine, so that we can make sure that the vaccine that is distributed to the last mile are still valid, are still effective in preventing someone to get kind of serious symptoms from the COVID-19, right? The third point that I want to share with you is that given the challenges that we have, especially with how big the Indonesia is, right? How difficult is transporting, this kind of stuff or vaccine in some area, right? And then also how diverse is the situation that we have in some area to another area. We still have to deliver this vaccine effectively and efficiently. Some of you might not have experience, right? Traveling to some part of Indonesia where it's really, really difficult to travel to, right? It's not easy to compare the situation that we have here in Java Island or Bali or Sumatra with, let's say, some area in Kaltara, some area in Malino, some area in Papua, right? And still, we have to deliver this vaccine quickly, and we have to maintain the quality of this vaccine, and so on and so on. So the challenge is something that we never experienced before. The fourth point that I want to share with you is that there are some requirements, there are some, expectation that we're gonna deliver authentic vaccine and we still maintain the quality, even though we have some challenges in transporting or distributing this kind of vaccine. The authenticity is paramount important here, because as you may know that in about 2013, 2014, we had some bad experience when we distribute vaccine and turn out that's fake vaccine, right? There's some, fraud in some area. There are some fraud in distribution channel, that kind of things that make us very worried that, this vaccine, this COVID-19 vaccine will be fraud, and eventually some people will get benefit from it. So maintaining authenticity and quality, guaranteeing, those two are very, very important in this kind of situation, right? The fourth, the fifth point that I want to share with you is that this vaccine is probably the most wanted item several months ago, right? It's very limited. Everybody wants to get the vaccine as soon as possible, and also the price of the vaccine is very expensive. You can imagine that one truck of vaccine could cost us about probably $40,000. About $50,000. That it's like the small truck, so it's very expensive. So we have to make sure that those vaccines are delivered properly. At the same time, the people who are transporting this vaccine are safe as well, from the security breach or something like that. And then the last one that I want to mention to you is that, transporting this kind of vaccine in this kind of situation with this kind of number, we need very well orchestrated operation, right? And some of you might know as well that to do this kind of operation, we have to include people from Ministry of Health. We have to include some people from state-owned enterprises. We have to include, police. We have to include some, in some area we have to include army as well. And then, of course, we have to include some private company in this kind of operation. So giving all those people that are involved in this kind of process, the operation must be orchestrated in some way, so that we can successfully deliver the vaccine, efficiently, effectively, and also meet all the requirements. Those are kind of the context that I want to share with you about how we come up with this project. Right? So what we developed, what we created is a system called SMDV. That's in Indonesian. It's in Bahasa. It's called System Management Distribusi Vaksin, or we can call it a system for managing vaccine distribution. And when we talk about that kind of system, we're not only talking about how we distribute, right? There are some point that we have to establish first before we can do distribution properly. The first step that we need to do is in the manufacturer side. We have to make sure that we can establish identity on every vial, every bottle of vaccine that we produce by attaching some kind of barcode on it, so that we can track we can establish the identity of that vaccine. We establish a way for us to check whether this vaccine is authentic or not. And then also we need to establish a way, we need to find a way how to track that vaccine special ID, that bottle along the way from the production side until the last mileage of the distribution, which is on the patient side. I will give more detail about the technology in the next several slides. That's on the manufacturer side. On the distributor side, as well as health provider side, is that we have to make sure when a vaccine moving from one area to another area, from one hand to another hand, must be distributed, must be recorded, that process of hands-over, right? And then also when we, along the way, of course, we have to monitor the temperature of the vaccine to make sure that, we do not expose the vaccine to the environment or the temperature that is not, that's not allowed. Right, and then you can see here, from the manufacturer, which is in this case is biopharma, we have to distribute to the distributors, and then from the distributor we need to deliver to province as well as town, like province health facilities, or province health department. And then from that province, we have to deliver. Sometimes we have to divide, some of the boxes into 2 boxes, and then along the way we have to transport to different cities. And then from the city, we have to deliver to healthcare facilities, and so on and so on. And eventually, somebody, either a doctor or nurse, will inject that vaccine to someone, right? To the customer, in this case, is to a patient, right? And then from the patients, of course, right now almost 90% of the vaccine are paid for by the government. But in some cases, we also have about 5 or 10% the vaccine will be paid by someone else, which is not the government. You can see here today that we have vaccine gotong royong, which is paid for by a company where that patients work for. Right? And the way we establish the system is that with the goal, with main goal is to establish physical as well as digital identity, and then establish a way to check whether a vaccine is still authentic or not. And then, of course, we have to guarantee the quality of the vaccine when we store it, when we produce it, when we store it, when we distribute it, and when we inject that vaccine to someone. We also come up with a dashboard, like command center, where somebody from operation will take a look, and then if there is some abnormalities, we will have some kind of notification or alert on the screen so that we can do follow up quickly. And I can share with you one of the example that we have about a couple of months ago. If you are familiar with Bandung, right? When the vaccine were departing from Biopharma, it's about 5 minutes from the Biopharma, we got notification that the temperature on the truck increased into 13 degrees Celsius, which is not allowed because the maximum of the temperature is 8 degrees of Celsius. And suddenly, it's like a notification alert pop up in the command center, and luckily we can respond quickly so that we can fix the problem with that truck. That's kind of the system overview of this distribution management system. The next thing that I want to share with you is about the technology, kind of the technical aspect of this system. So you can see here that we have some system that we embed into the production facilities so that we can attach a barcode on every vaccine that we produce. And then also we have some IoT capabilities, sensors on the truck that we use. So in the truck, we have some sensor for the temperature. We also have GPS location sensor. We also have some behavior sensor on the door, right? So that truck cannot stop anytime, it's like without like strong reason, as well as, the driver cannot open the truck door anytime. We monitor everything, it's like a couple of times the truck stop in some area and turn out that there is traffic jam. So we can do follow up with that kind of things, right? The sensor are also installed on the hub or on the distributor when we store the vaccine temporary. Then we have some kind of storage. We install the IoT on the storage, and many things that we do, which is basically to monitor the vaccine, every vial of vaccine about every 5 minutes. You can see here that we use some kind of technology. For example, for the connections, we are utilizing LoRa, which is some kind of low energy capabilities that we can use to track the location of an item, right? This is what I said before, that we establish identity of the vaccine by attaching some kind of barcode, which is GS1 data matrix barcode. It is very small barcode that we print out with some kind of code, and we can scan the barcode, and then we can easily come up with some kind of information from that barcode. As you can see here, that we have some item identifier for that vial. We also have expiration date, we have batch number, and then also we have serial numbers. This GS1 data matrix is new, standard, and will be required by WHO as well as by UNICEF for every product that needs the license from or approval from the WHO. In addition to attaching that barcode on the vial or on the bottle, we also have that barcode on the secondary package as well as on the tertiary package. And the concept that we have here is more of parent and child connections, so that when we have this secondary packaging being scanned, we can easily know like how many vaccine inside this secondary package. We know exactly the ID for each bottle in this secondary package. The same rule applies to the tertiary package. So when we have tertiary package barcode being scanned, we know exactly how much vaccine, how many vaccine in that box, how many secondary boxes of vaccine that we have on the box, right? And you can see here that this is the vaccine produced by Biopharma. In this case, every vial of vaccine, we have about 10 doses. And every secondary package, we have 10 vials or 10 bottles of vaccine. So you can say that one secondary package, we have 100 doses. And then the last one, the tertiary package, it contains about 20,000 doses. And then all this information are linked into database that we call as track and trace database. And this database connect with Biopharma distribution system as well as Indonesian FDA. I'm telling you that it's like a couple of times the Indonesian FDA or Badan POM auditor travel somewhere and then they scan a bottle of the vaccine. They know exactly whether this vaccine still valid or not, and then when it's being produced, or where is the expiration date, batch number, serial numbers, and everything, right? And even you'll see in the next several slide. So whenever somebody got injected by the vaccine, there should be a rule that connecting that vaccine ID with Indonesian national ID, so that we can link that somebody got this kind of vaccine, vaccine ID number, blah blah blah, expiry date, like this, batch number and serial numbers. So we link the identity of the vaccine as well as the identity of a person, a recipient of that vaccine. This one is another visualization that I want to share with you, that we established that digital ID on the production side, on the production line, when we establish this vaccine has this kind of ID, right? And we use that identity for tracking, which is basically every time, every minute, we know exactly this kind of vaccine located in which area, or whether this vaccine has been exposed to some not allowed temperature and something like that, right? And and at the same time, whatever tools that we use to store the vaccine or to transport the vaccine, whether it's storage, vaccine storage, or a truck, we embed GPS location sensor as well as the temperature sensor. And one thing that I want to highlight here is that in addition to have this kind of digital solution, we also establish the business process, because digital solution without business process, without standard operating procedure, it won't work. We know exactly that nothing or majority of the solution that we have is combination between digital technology and manual process as well, right? The thing that I want to share with you is one step, which is it seems very simple, but if the person that person or the person responsible for that process doesn't do the thing that they should do, then it won't work. Like for example here, when a secondary package of the vaccine being placed in the tertiary package, they need to scan it, right? Without being scanned, this secondary package will not attach with the tertiary package. That's manual process still happen right now, and we are working really hard right now to come up with another solution, which is more of like automatic solution, but it takes time. So come back again to the point that I mentioned before, that without business process, without manual business process, without manual standard operating procedure, it won't work. we need to combine, the digital solution with non-digital solution. And the last one that I want to mention here is about downtime protocol. That's also very, very important. We establish or we design a system to work 99% of the time, but there is always incident. There is always time when the system is down, right? When the system is down, the process cannot stop. This how critical this process is, right? How critical is vaccine distribution is. So that we establish what we call as downtime protocol, meaning that if the system doesn't work for so many reasons, we have to follow the downtime protocol. It happens, about a couple months ago when we have internet problem in Papua. So we at the time we were distributing, I believe it was about 200 doses of vaccine in Papua Barat, and that day the internet was down for a week. So it's kind of impossible, right, to wait for the internet to be restored, right? So we use the downtime protocol, at the time, and when the system back online again, then whatever data that we have from the downtime protocol will be input into the overall system, the digital solution. I want to share, some picture about our command center here. So you can see here that we established 2 command center actually, the one in Jakarta and another one in Bandung. We have 24/7, 24/7 command center being operated by by at least 5 people at one time, and we have been monitoring this vaccine distribution for 24/7 basically since early January until now. We have some story, it's like a funny story, some story that I want to share with a couple of you probably next time, not in this kind of event. But it's like we are very proud with what we have been doing with this vaccine distribution. And this command center have been replicated as well to some offices. Like the one that I remember is that this command center is currently at the Minister of Health office, Minister of State-owned Enterprises office. We also have this command center being replicated at the National Police, as well as in some very important office as well. The next one that I want to share with you is about the overall business value. Right, to establish this kind of system, we have been spending enough money. I think it's big enough. It's expensive, right? Establishing very robust system with 24/7 operation for critical mission is just not easy, and we have been spending enough money. I cannot share it here, but it's big enough. So the question is that what kind of business value that we're looking for from this system, right? And here I outline 5 points. The first one is to establish physical as well as digital identification for the vaccine. And turn out based on the statistic that we have, not in Indonesia, the statistic that we got from a consultant as well as from the WHO, turned out that about 2% of the vaccine going out to the market is lost. Lost because of the theft, lost because of the fraud, or couple things, right? And if we evaluate that number, multiply by the price of the vaccine, multiply by a number of vial that we have, we can save, the business value coming from preventing that theft as well as from fraud is about 1.7 trillion rupiah. It's good number, right? And the second business value is to establish authenticity. So we guarantee the authenticity of the vaccine. And based again on the statistic that we got from the WHO, there are so many vaccines, about 3.5% or almost 5% of the vaccine that are in the market is not authentic, right? That statistic is not from Indonesia. That statistic is from WHO. But if we use that kind of statistic, then we can save money about 5.1 trillion rupiah just by preventing, that kind of problem to happen, right? The next one that I want to share with you is that the problem of the quality, right? We know exactly that some vaccine needs some kind of guide, kind of requirements when being transported or being stored. And based on the statistic again, that some of the vaccines that have been distributed are not maintained their quality, right? Because of being it's like accidentally being exposed to the environment that they shouldn't be in, or being exposed to too much light, like sunlight, can reduce the quality of the vaccine. And by preventing that kind of things happen, we can easily save about 4.3 trillion rupiah, right? And then the next 2 points that I want to mention here about the business value are well orchestrated operation as well as fast response to every operation challenges. The story that I mentioned at the beginning about suddenly the temperature on the truck spike. If we do not respond quickly, if we do not get notification from the system, then that vaccine will probably not effective anymore, because it has been exposed to something that it shouldn't be. And then the last one is about well-informed decision making, right? Knowing like how many vaccine in some area, it's like knowing how much stock that we have on the national distribution center, knowing like how many vaccine that we need in some area will help some people on the high level to make quick decisions. The decision that is based on information, based on valid and evidence-based information, right? So those are the business value that we're trying to get from this the implementation of vaccine distribution system. Point number 1, number 2, and number 3 here: 1.7 trillion, 5.1 trillion, 4.3 trillion are not mutually exclusive. There is some overlap between those as well, but it's really good number that we can save from the implementation of this kind of system. Now let's talk about the story of this system. Actually, this system was built about 3 years ago, more than 3 years ago. So there's some idea, some kind of proof of concept that was initiated by Bio Farma as well as Indonesian FDA. And we did pilot in 2 towns in West Java. But since then, it's just pilot, never move on to different level, right? And suddenly we have COVID-19. So from my opinion, COVID-19 is more of like the most effective chief transformation officer, something that can, transform how we do something, right? I think what we are currently doing right now is being transformed by COVID-19. In the past, when we have this kind of conference, we always, travel to some area and then we spend, it's like enough money on that area, and then couple of things that need to be physical. But right now with COVID-19, turn out we can do this kind of conference online, right, with very minimal cost, I believe. I don't know like how much cost that you spend, but I think with very minimal cost. The same applies with the story that I have here, that the system that we built about 3 years ago never move on, never move on to different level, never went to even just pilot, right? But with this kind of COVID, everybody said that no, it's impossible to deliver 600 million doses of vaccine without a system. So the direction is from the top, saying that no, you have to implement digital solution. And then the system that was always on the system that was always on the pilot stage suddenly has to move to national-wide operation, right? There's something's not easy. There's something that not even probably the developer of the system can imagine at the time, right? Suddenly we have to add Internet of Things to make sure that the vaccine being monitored. Suddenly we need dashboard, because everybody, especially like high level decision maker, needs to know where the vaccine is, right? And many things that we have in this kind of operation. So from it's like the development from very long time idle suddenly become very active in national level, right? And then suddenly there is new initiative that we will not track we will track not only vaccine but also medical devices, but also drugs and other vaccine, right? So from pilot in 2 towns right now become operational in 514 towns, and then right now we move on to like different stuff, different items that we will monitor all the time, right? So from this example, I want to share with you that this COVID-19, it has some positive impact in some area. We have some challenge in the past to move on a system from pilot or from POC to operational, and we did it with this COVID-19 trigger, right? So probably that's the end of my presentation. Thank you so much, and I know that we still have time for Q&A, and I'm very excited to have Q&A as well. Thank you so much, and I'll give the time and place back to the moderator.
Thank you, Mr. IEEE. That's very interesting speech, and I can see that we already have 1, 2, 3, 4 different questions in the Q&A box. Do you like me to read one question at a time and you answer it, or is it okay for me to combine some questions for you?
Yeah, just combine it.
All right. We have 2 questions from Mr. Retantio Wardoyo, PhD. The first one, is there any possibility of leakage, say from a vehicle while on the move? And the second one, how do you classify what are the area is given AstraZeneca or Sinovac?
Okay. So leakage, up until now, it's like we don't have that kind of problems. The what I understand by leakage, meaning that it's leakage from the bottle, right? Is that correct?
Yes, I think so. Yeah.
Yeah.
No,
I hope that's
not from the bottle, but from let's say people take out from the vehicle. It's on the move, and they can sell the vaccine. That's actually my question.
Oh, okay. So here, as I said before, that the truck being monitored all the time, and then what I meant by monitor is that the first one is GPS location. So every time, every second, we know exactly whether this car is moving or not. right? The second one is that we install IoT or sensor on the door of that vehicle as well. So if that door being open not on the destination, it will trigger a sensor. It will trigger some kind of notification to the command center, right? And then the last one is that in addition to that, we have camera as well inside the truck. So we know exactly what's going on real time. And then based on, all the things, we know exactly that that truck never stopped in not in destination, right? And the second one is that if somebody opened the door, we know exactly that they open it in the area that that is monitored, or that is um, that is like the final destination, not in the between. The second question is that how do you classify what the area is given AstraZeneca or Sinovac? So the decision coming from Minister of Health. So Minister of Health just say that, okay, you, Biopharma, can you distribute this vaccine, this amount, like 2,000 vaccine of AstraZeneca to, let's say, Jakarta Selatan, and we'll do it. So the decision to give either AstraZeneca or something else is made by the government. It's made by the Minister of Health.
All right, I think that's already answered those two questions. Thank you, Mr. Ivi. Next one, we also have other questions. In your opinion, what is the biggest challenge to transport the vaccine in Indonesia?
We have so many challenges. Like the physical or infrastructure is probably the biggest one, especially in some area like spatial remote area. There are some area in Kaltara or Kalimantan Utara or North Kalimantan, right, where we have no visibility at all of the vaccine for about 2 hours. No signal at all, nothing on that area. It's like blank spot. And then the second example that I want to share with you is in Malino. Malino is the area around Sulawesi area, right? We have to deal with weather. We have to deal with the infrastructure that, probably some of the people in Java Island never imagined before, right? At some point, we have a truck, and then we have to change the tire 3 times. It's like advisable that you have to bring like multiple tires that you will need at some point, because of the road is very, very bumpy or very, very, very bad. And the last thing that I want to share with you is about the people, right? At the beginning, I said that people is a key for this kind of implementation. And imagine if you have to train a driver of the truck who never touched smartphone before. And then suddenly you have to ask them to operate an apps, to scan, not to scan, to report something, that kind of things. They never touched smartphone before, right? And we have to train about 200 people with different background, with different experience with technology. Even it's like a couple of times, we train a group of people for more than 7 times, and they still have problem to operate that kind of things, right? So what we did is that we created what we called as checklists. Some of you, if you read Checklist Manifesto book, it's very popular book written by Atul Gawande, I think. So we established that concept, checklist. Basically, if somebody move on, or before the driver departing from Biopharma, we're gonna check every item that they need to have, like as very as detail like how much money that they have on the toll road, on the toll card, right? Like how much money that they have on the smartphone to make sure that they, you know, they still have internet until the last point. You know, that kind of thing we check it every time, you know, it's like this driver departing from biopharma. The same principle applies when we deliver, when we drop the vaccine. We have to make sure, okay, we check these things, you know, we ask for signature from someone, we scan this thing, you know, that kind of thing that we did. And even with that kind of, you know, it's like checklist, some people still miss it. That's the reality that we should understand in this kind of situation, right? But one thing that I'm very proud of is, as of today, we have been distributing about 93 million doses of vaccine, and we have all the record. We have all the record nicely, and we have, you know, all the documentation from every vaccine, and I think we did it very well. And of course, it's not done yet. You have still just halfway to go, but I think it has been a very good experience for me personally and for many people. All right.
Right. Thank you for the answer. We still have a lot of questions. Do you mind to have 1, 2, 3, 4, 5 more questions, or should you choose something? Okay, I'll read the next one. What is the current strategy in developing applications during the pandemic to post-pandemic? Do you have your thought on this?
You know, I think the strategy is still the same, but just the way the people work are a little bit different, right? Previously, we have some kind of office hours. Suddenly, we have to work from home, and then that office hour become very flexible. Some people lost control on it, and I think it's very bad. You know, I have about 200 people in my teams. Suddenly, I have some people who, you know, becomes obese. Suddenly, I saw some people who have no sleep like for a couple of days because, you know, after working, you know, they're watching, you know, suddenly become sick, you know, that kind of things, right? And then also we have some improvement on productivity in some group, but I do see, you know, some decreasing as well about this productivity on the other group. So for me, it's more of, you know, it's like how to manage people in these kind of situations. The project, I think, still the same. How we develop a system still the same, but just a matter of, you know, how people work, how people you know, it's like handling a project more efficiently is the true question, right? And then also, you know, some of you are noticed as well that when we meet, when we have face-to-face meeting, we can easily come up with decision making, right? We can easily, you know, draw something on the wall or on the paper, and then everybody understand, everybody on the same page. But using Zoom, you know, it's not as easy as that. You know, it's like sometimes, you know, after you know, arguing here and there for a couple hours, and everybody said, oh, you know, we're talking about the same thing. So that's my answer. I hope it helps to answer your question.
So mostly on how people work differently before and after a pandemic, right? Is there any also challenges on the restriction of transportation between areas, do you think?
I think we have some privilege right now, right? So we have, you know, basically, you know, if you are biopharma employee, you bring a letter from biopharma, you wear, you know, biopharma name tag, and you can go wherever you go. You can go, you know, whenever or wherever you want to go. However, there are some area where we do need to transport the vaccine by airplane, and suddenly we don't have airplane. And they stop for a couple of weeks. there's nothing that we can do. However, a couple of times, if the need is very critical, then we ask help from national police or from national armed force, and we deliver the vaccine using their airplanes. But in Java and Bali, we have no restriction at all.
Right. Thank you, Mr. Ayubi, for the answer. Next one, what are the obstacles in developing healthcare, bioinformatics, and biomedical application? Is this possibly because there are not enough experts in the field of these applications, do you think?
There's a couple things, right? The first one is, of course, about regulation, right? When you bring a software to a doctor or to healthcare workers, the thing that the first question that you need to answer is that how safe is the software for the patient, right? It's very highly regulated area. If the software is only to support administrative process, let's say for patient registration, for the payment, that kind of things, there's no difference with the other industry. However, if you touch some area where the clinical outcomes may be affected by that, then you have to deal with some regulation, whether it's safe, whether it's effective or not, right? Some people here, I believe, have experience, including you, right, Angela, that when you come up with some kind of AI based recommendation, people will ask, is it safe, right? And then if you say yes, that's not enough. You have to prove it. You have to explain it and why it's safe, right? Why it's not safe, right? And then, of course, there is some difficulty when we deal with machine learning or AI. The explainability of AI and machine learning are not established well yet, right? There are some challenge on to explain why this machine learning comes up with this kind of recommendation. We cannot just say, oh, it's based on recommendation from machine learning. They will not accept it, right? The second thing that I want to share with you is that historically, healthcare is always 5 or 10 years behind the other industry in adopting technology, right? Including just adopting a computer by doctor. They are always 10 years behind. In the other industry, everybody has been typing something on the computer, and then you still see at the same time the doctor still write prescription on the paper, right? So there are some was that the nature of the healthcare industry is always like that. However, there's some light of hope when we have new doctors come in, right? When new doctors who are basically who are technology savvy, from the birth, we have a lot of opportunity to utilize technology to bring new technology to hospital floors, for example. And of course, the last one is that about the people who really understand, so like we really need a lot of people who understand the healthcare as well as the digital aspect. Right now, you can easily find 1,000 people who understand about digital technology and finance, right? Digital technology and commerce, because it's very easy to digest. It's very easy. It's very simple industry compared to healthcare. However, if you look for someone who understands the digital technology as well as healthcare, it's not easy. Trust me, it's very difficult to find those kind of people. And of course, if you want people who are experienced that kind of things, who have that kind of experience, is even harder. Okay, I hope that answered your question. Yep.
Yes, I think so. Thank you. The next question, I think, has been answered before. This is about how to apply the right vaccine in the distribution of the vaccine. Yep. We already covered that. And then the next one would be, in case of fraud, how quickly can identification and action, for example, by the police, be carried out?
Yeah, it's again, as I said before, the digital solution needs to combine with business process and standard operating procedure, right? If, for example, in doctor office, a doctor or nurse scan the vaccine, and then a message pop up that this vaccine has been used in next town, then what we're gonna do, right? There are some channel to report this kind of vaccine. That channel still manual channel, meaning that so we have Badan POM, we have Dinas Kesehatan, we also have some kind of BPKP or something like that, and you have to report it. You have to keep the vaccine and then you have to report it. But that needs manual process, right? The doctor needs to understand that, okay, this one is not authentic, or it has been used by someone in a different town. It must be fraud in this area or something like that, right? So to be honest, when we deliver the vaccine, when we drop it, we lost control on it, like technically, right? Of course, along the way, as I said before, if we transport the vaccine and suddenly there is abnormality on the behavior of the driver, abnormality of the movement of the vaccine, then we can intercept. We can do something. But once the vaccine being dropped to the healthcare facilities, to Fasiankes, to Puskesmas, then we need some kind of manual interception on it.
Right. Thank you, Mr. Ayubi. I think this is the last one that we will cover in the session. The last one is that currently there are some issues that vaccines containing chips to track people activities based on their ID, I think from the KTP, and this is frightening. Do you think this issue is correct, or do you have?
No, it's not right. It's not true. It's not true.
So this is about the data privacy, right? What will you use the data that we have for this purpose, for this vaccine?
Okay. Here we have regulations. We have auditors here and there. We also have right now, for example, biopharma, right? We have a board of commissioner, we have board of advisor, we have like minister state-owned enterprises, right? We have so many people overseeing what we have been doing, right? And also we sign some kind of pact that we will not use distribution data, or we will not use vaccination data for other than service that people for the vaccination only, right? We will not use this kind of data for marketing campaign, for something else. No, we don't use it. Then some people also ask me whether somebody will use the information, the vaccination information for political campaigns in 2024. And that's question rise couple times, but from biopharma perspective, we do not have any interest, and we will not do it.
Well, thank you, Mr. Sarayubi, for your outstanding presentation and also your replies in the discussion session. I think that is very interesting for us all. Also, thank you for all participants for your attention and your cooperation during this keynote speech session. I hope you enjoy it and you can get some insights for your future endeavors. And then that's the end of the session. I'd like to return the session to the Master of Ceremony.
All right, thank you so much. Thank you for having me.
Thank you, Mr. Ayubi.
Okay, thank you, Mr. Soleh Ayubi, PhD, and Miss Angelina Prima, PhD. That was very amazing session. And now we would like to kindly invite both of you to have a photo session. Would you please kindly turn on your camera? All right, so we would like to invite the committee to kindly capture this sweetest moment within 1, 2, 3. 1, 2, and 3. Thank you so much. That was very beautiful. Thank you, Mr. Soleh Ayubi, PhD, and also Miss Angelina Prima, PhD, for this session. Ladies and gentlemen, the keynote session 3 marks the end of the opening ceremony of the NINT ICoICT 2021. To remind you all that if you wanted to rewatch the whole program, you can refer to our YouTube channel. Please refer to School of Computing Telkom University YouTube channel. And after this, there will be a 15-minute break before continuing to the next agenda, that is Birds of a Feather session, which will be started in 15 minutes ahead. Therefore, we would like to kindly invite every one of you to attend the Birds of a Feather session, which will be conducted in the separated rooms. And for you, if you would like to join the Birds of a Feather session, the link of the registration have been announced in the chat box. And those are the topic of the Birds of a Feather session in each room. Do apologize for that. And the Birds of a Feather one, hosted by Dr. Maya Arianti on the topic of data science, e-learning. Birds of a Feather 2, hosted by Ms. Afia Hayati, PhD, on the topic of AI and bioinformatics for COVID-19. Birds of a Feather 3 will be hosted by Mr. Kemas Rahmat Saleh, PhD, on the topic of knowledge management, knowledge representation, and reasoning. Birds of a Feather 4 will be hosted by Dr. Agus Hartoyo on the topic of artificial intelligence of things, AIoT, the intersection of AI and IoT, and the Birds of a Feather 5 will be hosted by Dr. Muhammad Johan Alibasa on the topic of digital footprints during COVID-19 pandemics. Once again, the link for the registration of the Birds of a Feather session have been announced and attached in the chat box. Ladies and gentlemen, we also would like to invite every one of you to attend the second day of the NINT ICoICT 2021. We will present to you the outstanding keynote speakers and also tutorial speakers and of course knowledge transfer tomorrow. There will be Dr. Hamam Riza, Chair of the Agency for the Assessment Application of Technology on the title, Digital Innovation for Post-Pandemic Recovery. Knowledge transfer from Mr. Wu Shiwei, the Chief of Technology Officer of Asia Pacific Region, Huawei Cloud on the topic of workforce enablement in the new normal of post-pandemic powered by cloud technology. There will also be Dr. Bayu Ervianto from Telkom University on the title, Chase Wall Motion Tracking Using Inertial Measurement Units or IMUs. Mr. Muhammad Edi Wibowo, PhD from Universitas Gadjah Mada, Indonesia on the topic of phase analysis in public space. There also be Professor Dr. Kazem Rahimi from the University of Oxford entitled Machine Learning and Digital Technologies in the Context of Epidemiology and Clinical Trials. And last also, there will be Dr. Muhammad Hardiman Barawi from University Sarawak, Malaysia, on the topic of modeling sentiment and contrastive opinion of COVID-19 pandemic on social media, linking computer science and social science. And never forget, of course, to remind all of the authors and also presenters to get ready yourself, especially to be awarded the Best Paper Award, which will be awarded on the third day of the NINT ICoICT 2021. So we are looking forward to seeing you again tomorrow. So ladies and gentlemen, this marks the end of the opening ceremony of the NINT ICoICT 2021. On behalf of the committee, I extend a warm gratitude to Telkom University, Multimedia University Malaysia, Universitas Gadjah Mada Indonesia, the IEEE Indonesia section, IEEE Signal Processing Society Indonesia chapter, the Indonesian section Computer Society chapter, keynote speakers, tutorial speakers, presenters, and attendees for your time and attention. And never forget to say good luck to all participants of the NINT ICoICT for your Birds of Feather session, and of course for all the sessions. And we hope you gain valuable knowledge, build stronger network, and also develop future career. Good luck to you all, and I'm Yen Hamidah. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
A wondrous civilization. Disposed to tranquility. With scenic landscapes bordered by the sea. Here, mythologies become principle. And religions create the cornerstones of life. It is contained in the arts and crafts, where celestial ceremonies become part of popular culture. Legacies of glorious traditions, where folktales are regarded as guidebooks to perfection, honed over centuries, yet possible to experience within a few hours. Experiences you can take home. Here, art preservation is a tourist attraction. History is a living monument. Even shopping is meaningful. See world-famous resorts compete with local means of accommodation. Enjoy natural kindness. Or the excitement of exploring nature. With endless stories to tell. And never-ending feasts. Never-ending possibilities. To get more out of life and journeys. Yogyakarta. Wonderful.
Ini adalah waktu kita untuk mengerti jarak. Ini juga waktu kita untuk bersabar, menahan rindu. Rindu pada Jogja dengan segala ceritanya, ketekunannya, perjalanannya, menjelajahi makna Candi Prambanan hingga menemukan titik tengah kota. Kokohnya tubuh Jogja di antara keramaian. Bersabar sekarang, biar besok bisa rasakan lagi magisnya momen saat di Jogja. Di saat kamu bersabar menahan rindu dengan menunggu, di sini Jogja akan selalu menunggu.
Digital Visa untuk kalian yang lapar akan hiburan. Digital Visa Untuk kalian yang penasaran dengan pengetahuan, digital bisa. Untuk kalian yang pengen bergaya, beli apa aja. Digital bisa. Untuk kalian yang pengen happy, di rumah aja bisa tetap party. Digital bisa. Untuk kalian yang anti nge-lag, jadi tetap connect. Bahkan digital bisa untuk kalian yang anti ribet dan pengen cepat. Karena digital bisa untuk Indonesia lebih baik.
Efficiency, cost, productivity. Business as usual has always been about turning a profit. If you stop to think about it, what more is there? The universe, nature, life, civilization as we know it is about the search for something greater than ourselves. Huawei Cloud is innovating technologies to make the world more inclusive. The cloud, AI, 5G are building a fully connected, intelligent world. They do more than drive digital transformation. It's a new paradigm for innovation. Imagine, if you can, what amazing secrets await when we unlock the secrets of the universe. What cosmic answers will we learn? AI can help preserve in the rainforest by identifying the sounds of gunshots or the sounds of illegal logging, protecting the most precious sounds, birds and trees for generations to come. In cities around the world, we can collect traffic data and analyze it to improve transportation and bring order to a chaotic world. Even reporting the weather can be improved with AI. With more accurate forecasts and timely alerts, we'll travel safer and get home to our loved ones. Also, so many delicious flavors, chili, herbs, and spices automatically selected to improve flavor, quality, and nutrition. Delightful flavor explosions to dazzle our taste buds. A cloud for everyone, unleashing the power of innovation, making every day better. A cloud for pervasive intelligence and a better future. Huawei Cloud. Grow with intelligence.